When I worked in the fire service, after a big incident, we would do something that we called a post-incident action review. And the reason for that is in an emergency, especially a major structure fire, there is a fair bit of chaos, there's missing information, there's people doing their best to remedy the emergency. Yet because it is an emergency and we're working with incomplete information, inevitably there's things that could have been done better, mistakes that may have been made, and things that we could learn as a department. So a way that would work in the fire service is usually several days or a week after the actual incident, the people that were on that call would convene in the training room and we'd go over what happened, what we did well, what we didn't do so well. And the whole purpose of that was to learn from the experience so that we could be better prepared next time a similar emergency happened. The nature of an emergency is sometimes good decisions lead to good outcomes and bad decisions lead to bad outcomes, but it's not always that case. Sometimes you can actually make a bad decision and just by chance get a good outcome. And conversely, sometimes you can make every decision correctly and just by the nature of an emergency, you still get a bad outcome. The reason for doing a post-incident action review is to learn from our past experience. Now that the COVID emergency itself seems to be over, I think it's time that as a society, we take a little bit of time and do a post-incident action review on our response to COVID. Figure out what went well, what didn't go so well, and most important, what we can learn for the next time something like this happens. Now, doing a post-incident action review for something like COVID, which is inherently complex, it's global, involves economies, involves the human body, obviously, we have to make sure that we don't take an overly simplistic approach, but rather maybe choose some specific categories and delve into those and see where we went right and where we went wrong. Ideally, this would be a role that could be fulfilled by our mainstream media, but I worry that perhaps because they were too involved in pushing a certain narrative throughout the pandemic, that they're not really in a good position to ask honest questions and seek honest answers. One journalist who I think's done a good job in this front is Rupa Subramanya. She recently published a piece talking about how Transport Canada, and this was discovered through court documents, how they admitted to not relying on any specific science or research to come up with their requirement to be vaccinated to get on a plane or a train. But through these court proceedings, they essentially admitted that the only reason they came up with this mandate was to encourage people to take the vaccine. Now, some people think that the vaccines are great and have done a good job with COVID, and that might be your opinion, but do we really want an agency like Transport Canada using its authority to manipulate people in doing something, even if that thing is good? For example, eating your vegetables is good for you. Do we want an agency like Transport Canada to insist that we eat a certain number of vegetables before we get on a plane? Obviously, something like that is absurd. So why then is an agency like Transport Canada insisting that we take a vaccine to get on a plane or a train when, by their own admission, there's no scientific evidence that suggests that that's necessary? What I like about Rupa's approach here is that she chose a very specific and narrow part of this puzzle and dug deep into it to reveal what was happening behind the scenes. Now, this doesn't always make for compelling news because people aren't really interested necessarily in hearing about certain court proceedings or parliamentary committees and the like, but I think this type of work is important if we want to better understand how our governments and authorities have acted during this pandemic. Now, that's a narrow look, and I think those are important too, but there's some issues that are much more broad. I think the most obvious one there is the economy. Now, economies are complex, obviously. We seem to be having record inflation. Things don't seem to be going so well in our economy. And I'm not saying that this is all due to government spending, but it does seem like our governments have spent a lot of money and borrowed a lot of money, and one wonders what impact this may have had on the economy at large. One of the things that one needs to be aware of in the fire service anyway, when doing a post-incident review, or something that I've learned, I guess, over the years, is sometimes in an emergency, it's natural for a first responder to get a certain type of tunnel vision, where you see a certain problem and you tend to fixate on that and perhaps ignore other more nuanced part of the emergency. And it's good to be focused, but if you're too focused, you tend to miss things. And I think that's happened here with the reliance on vaccines. Over a year ago, the CBC reported that the Trudeau government ordered 400 million doses of vaccines. That works out to 10 per Canadian citizen, or more than 10. And that was at a time when we were only taking 1 or 2 doses. Was Trudeau getting too fixated on vaccines? It seems to me that perhaps he was. More recently, the CBC reported that over 22 million vaccines have had to be thrown out because of lack of demand, and they've expired in the interim. Now, some people have argued that because this was ostensibly a health crisis, that things like the economy need to be subordinated to people's health. And while I don't necessarily agree with that argument, but even if you take it as valid, we need to ask, how has people's health been affected by the lockdowns, by the vaccines, and by other measures that we've taken to combat this COVID pandemic? There is some preliminary research out that's come out recently that's talked about how there seems to be a number of excessive deaths. That is, more deaths than one would expect based on data from before the pandemic, and that's after one subtracts the COVID deaths. Now, there's different theories as to what's causing these deaths. Some ideas involve what they call deaths of despair, that is, increased drug and alcohol use. Also, things like mental health problems have been exacerbated, some say. There are some people that say perhaps even the vaccines themselves may have played a role. My guess is it's probably a number of factors that have come together. But the point is, it seems that there are increased negative health outcomes after the pandemic than there was before. Was it the lockdowns? Was it economic impact? Was it these deaths of despair? Was it all of the above? These are things that are worth looking into. Another area that I think is worth looking into is the impact these lockdowns have had on children's education. McKinsey recently released a report suggesting that the lockdown measures, or the pandemic more broadly I should say, and the lockdowns are certainly part of that, have impacted children's learning. And what is particularly disturbing here is they found that children in low-income communities, Black and Hispanic children in particular, have been affected. Now, this was a US study, but I imagine that similar dynamics would work here in Canada as well. Now, I'm by no means suggesting that our policymakers set out to harm children. That would be absurd. And they certainly didn't set out to create problems for marginalized communities. But that just makes my point. There are often unintended consequences to these policy decisions, especially based on something this complex. I think our policymakers need to be judged not on what their intentions are, but on what the actual outcome was. Now, in the midst of the actual pandemic itself, there was a lot of people who said, well, this is an emergency, we need to act. We need to trust our policymakers, whether they, like for better or worse, they're the ones that are in place, and we all need to just get in line and listen to them. And frankly, there's some merit to that argument. And I think, in general, if we look historically, I think Canadians, as a general rule, would do well to listen to their authorities in times of upheaval. But I think it's also important to ask, what was the outcome of this? We shut down dissent. We shut down social media posts that challenged the narrative. So now we need to look back and say, did our policymakers act appropriately in the circumstances? Did they actually do what they said they were trying to do? Or did their policy decisions have tremendous unintended consequences that have maybe made some things worse as opposed to better? These are questions that every Canadian needs to be asking as we do our post-incident review on the COVID pandemic.